If you had a mammogram, you may have been told that you have dense breast. Our next guest is here to tell us about a new tool being used for this. Please welcome Beth Turner, Administrative Director of Baptist Women's Health Center. Welcome, Beth.
Thank you so much.
Okay, as I told you before we went on the air, I had a patient today that asked me specifically about the program you're going to talk about. She's had a history of dense breasts, which sometimes will make it difficult in finding masses in your breast and makes mammograms difficult. And Baptist has a new tool that can be used for that. Tell us about it.
Yes, it's called the A-Bus, or Automated Breast Ultrasound. It's a new machine, the Invenia GE A-Bus. It is FDA approved to be used in this purpose with dense breast tissue. Now, dense breast tissue is basically the relationship between how much regular breast tissue and fat tissue that you have in your breast. If you have more than 50%, then you're considered to have dense breast tissue. The reason this is important is it's been found to be 4 to 6 times greater chance that you'll get breast cancer, and it makes it more difficult for our radiologists to see that cancer on the mammogram. It shows up white if you have a lesion, and that density also shows up white. So it's kind of like looking for a snowball in a snowstorm.
Well, let me go back to what you just said. So if you have dense breasts, by definition, that increases your risk for breast cancer.
That's correct, 4 to 6 times.
And then on top of that, having the denser breasts makes it more difficult to even diagnose anything because of the limitations of the mammography.
That's correct.
And then the ultrasound is here now to give us a better picture of that.
Right. Now, we've had ultrasound in breast care for many years, but this is a new screening ultrasound that is automated. It doesn't require a technician holding the probe, but rather it scans all the fields of the breast very thoroughly. It's actually a 3D rendition.
Now, is this something that maybe could benefit everybody, or is it just for people with dense breasts?
It's specifically being used for dense breast tissue because it does show up those lesions that would otherwise not show up on mammogram. What has happened historically is you'll get a mammogram and they'll tell you that they don't see any signs of cancer, but now we're also informing patients that they do have dense breast tissue if that is the case. And then they will need to come back and get an A-Bus exam to rule out a hidden lesion that maybe is not seen.
Now, if a lady has had that history of dense breasts and they want to get this test done, how do they go about doing that?
You can just call 227-PINK at the Women's Health Center. That's our direct line for scheduling. But they do have to have an order from their doctor, from their primary care physician or practitioner. This is a screening test, but this one, unlike the first mammogram, does require an order.
Now, this is always the other question I'm asked. What about the insurance? Does insurance cover this?
Most insurances are paying for this, the same as they pay for diagnostic ultrasound. So far, we have not had any trouble for that. And we also do have an option for grant funding for those patients that do meet the criteria.
Now, A-Bus, spell that?
Mm-hmm. A-B-U-S.
All right. So, ladies, if you have an issue with dense breasts, ask for A-Bus to get you evaluated. Thank you so much for being here today.
Okay. Thank you so much for having me.
A final word on women's health next in my Health Matters memo. Stay tuned.